Good morning, everyone. It's a beautiful day, and we thank God for life. We're going to start now. Our speaker is online. I would like to call on Pharmacist Susan Ayetoro for the opening prayer.
Our God and our Lord, we thank you again for another day. We thank you for the gift of life. We thank you for the gift of life. We bless your name for the opportunity to see today. As we are going to start this program, we commit it to your hand. Start with us, be with us, and cause all our deliberation today to be acceptable in Jesus' name. We pray that those that we are waiting for to join this Zoom meeting, you will bring them in Jesus' name. Thank you, Lord. In Jesus' name we pray.
Amen. Amen. Thank you so much, Ma. That is our Pharmacovigilance Zonal Director. She's Deputy Director, Pharmaceutical Services, University of Ilorin Teaching Hospital, Pharmacist Susan Ayetoro. We appreciate you, Ma. I want to welcome you on behalf of the Acting Head of Department and person of Pharmacist Charles Nwakili to today's clinical meeting, put together by the Drug Information Unit, Pharmacy Department, University of Ilorin Teaching Hospital, under the leadership of Pharmacist IK Bedu, who is doing a wonderful job bringing this clinical meeting to us day by day. We appreciate you, sir. God bless you. I want to welcome the Director of Pharmaceutical Services in our midst, Fellows of West African Postgraduate College of Pharmacists, Fellows of Pharmaceutical Society of Nigeria, PSN, the Chairman Kwara State PSN, you are welcome, sir. The Chairman, Association of Hospital and Administrative Pharmacists of Nigeria, National, State, and UITH, you're all welcome. Professors and lecturers in our midst, pharmacist colleagues, home and abroad, you're all welcome. Medical doctors, nurses, other healthcare team members, and staff of University of Ilorin Teaching Hospital. Thank you for joining on the meeting today. And last but not the least, our guest speakers for today. So very briefly, our ground rules for the presentation. Everyone will be muted during the presentation. Kindly type in your questions and comments in the chat box, which will be attended to at the end of the presentation. Or you raise your hand for the question and answer time while you unmute yourself. Our first speaker will have 40 minutes to speak to us for his presentation. The second speaker will have 15 minutes, and then we'll have the question and answer time, 20 minutes in that order. You're all welcome once again. At the last clinical meeting, we looked at the topic COVID-19 vaccines, the ingredient, type, side effects, efficacy, and safety. Today, we're looking at the Kwara State COVID-19 updates and strategies to reduce the spread. You agree with me that this topic is very apt at this time when the new variant of the COVID-19 is present with us in Nigeria, as announced by the Presidential Task Force. So, and then we'll have the second speaker will have as a pharmacist who will tell us his story. Very quickly, I would like to call on our first speaker. He is Dr. Oladayo David Awoyale. He is a man with many portfolios, playing active role in training and education of workers in infection prevention and control as a major strategy to reduce healthcare workers' infection and that of the populace. He has spoken on most of the radio stations in Kwara State, places of worship and university, training and educating the populace. He is the Kwara State Deputy Epidemiologist, Ministry of Health, and the Operation Manager at Kwara State Public Health Emergency Operations Center. He will be speaking to us today on the topic Kwara State COVID-19 updates and strategies to reduce the spread. Dr. Awoyale, you're welcome once again, and over to you, sir. Dr. Awoyale, kindly unmute yourself. You have the floor.
Okay, can you hear me?
Yes, we can hear you loud and clear, sir.
Hello?
Hello, sir. We can hear you, sir. You have the floor, sir.
Okay. Thank you very much. I guess something is wrong with my own. Oh, sorry. My audio was very low, so I wasn't hearing myself. So I wasn't hearing you rather. So I thought you were not hearing me too. Okay. So if everybody's hearing me, good morning once again, everybody.
Good morning, sir.
I want to appreciate you for inviting me for this meeting, and the timing is very good, and is an opportunity for us all to rub minds together and discuss how we got to where we are today, and what strategies are we putting in place, and what do we expect healthcare workers, pharmacists, doctors, and other healthcare workers to do to reduce the spread of this virus. Okay, so am I permitted to share my screen?
You can share your screen, sir. You can share your screen.
Okay, I can share my screen.
Yes, sir.
This is still being disabled though. Most disabled participant screen sharing.
Go ahead and share, sir. You've been
Oh, okay.
enabled. Yes, sir.
Okay, good, yeah. Okay, so is my screen shared now?
No, sir.
Okay, I guess it is now.
Yes, we can see. You are on, sir.
All right. So quickly, I have a very short time to take this. So I'm going to try as much as possible to summarize to see how far we can cover what we're supposed to cover. So COVID-19, 2019 December, let me just give us a brief background of how we started. There was an alert of somebody who had symptoms that were looking like that of pneumonia in Wuhan City. We all know the story. And January 2020, the Center for Disease Control in China were able to identify the virus. And gradually, because of the capacity of the virus to spread very fast, started spreading from one community to another, state to another, country to another. And at the point where it crossed 2 continents, it was declared a pandemic. And as we are talking now, it has gotten to almost all the countries in the world. More than 222 countries and territories have reported a case. Our first case in Africa was recorded on the 15th of February in Egypt, and subsequently Nigeria diagnosed its own first case too, still in February. Okay, so it was identified that the causative organism is a virus that belongs to the family of coronaviruses, and it was named SARS-CoV-2. So in Kwara State, what did we do immediately we heard of the first case in China? we put our EOC for COVID-19 at watch mode. At this point, advisories were made, protocols were made, and we're having meetings. We planned a lot of trainings, and we developed our incident management structure, which is comprising of these 9 pillars here. And risk communication activities also, we started scaling up gradually. And we did risk assessments on a weekly basis for the states, using the geographical location of the states, the tendency of the disease to spread, the severity of the disease, our capacity to cope, political interest, and international significance of the disease. And these put us at a high risk. So as a result of that, okay, why were we at a high risk? Because as at that time, our neighbors, if you look at the map of Kwara here, you see that we have an international border and we have a state border. So we have 6 other 5 states bordering us and an international border. So at the Republic of Benin, then they had already reported cases. So that put us at a significant risk. And I'm going to share with us how we arrived at that. We were at this point in Barutin. This is Bokoro and Kasuala, very close to each other. And on the other end, they have reported cases. Subsequently, Oyo reported cases too, Osun and Ekiti too reported cases. So this puts Kwara at a high risk. So as a result of that, we did all these trainings, but we'll continue to do all these trainings. And we did simulation exercise, we started screening. But unfortunately, well, also as a result of our preparedness activities, we identified our first case in Kwara to be a confirmed case of COVID-19 on the 2nd of April, 2020. And the EOC that was in alert mode was activated immediately to response mode. The risk assessment that was done at this point put the state at an extreme risk, a very high risk. And when we talk about diseases like this, healthcare workers are supposed to have a high index of suspicion in order not to be missing cases and in order not to be putting themselves at risk. So the index case was that of a 45-year-old man, a British Nigerian, came into Nigeria. He did not have any symptom of COVID-19, but because of the travel history, it was tested for COVID-19 and it was positive. So this is the IMS structure we use. This is the reporting channel. If you see any suspected case, you can report to the focal person in your facility or your LGA disease surveillance and notification officer, or directly to the state. So let's see, where are we at present in Nigeria? Nigeria has tested over 1,270,523 cases, and we have confirmed more than 122,996 cases. So, but it's saddening to note that we have recorded more than 1,500 deaths. The global figure is far more discouraging. We have recorded, for us in Kwara State, we have tested, we are striving to do more.
I guess our guest speaker is having network issues. We'll wait for him. If we cannot get him back, we'll call on our second speaker who is ready. Unmute him. Hello, sir. Can you unmute yourself, sir? Can you unmute yourself, sir?
okay?
Okay.
So sorry about that. I guess there was a network issue. So, hello?
We
Hello?
can hear you. We can hear you.
Oh, okay. Thank you. Okay, so can we see my screen? So for Kwara,
Yes.
this is where we are. We have recorded 43 deaths as I'm talking to you. And this is the distribution of cases. We can see the LGAs that have between 1 and 100 cases, and those between 101 and 200 cases, 201 and above cases. Let me quickly rush through. We have a lot to talk about. This is the age distribution and sex distribution. So it seems to be more in males, 57.5% in males, while 42.5% in females. And this is the age distribution of the different cases we have had, the suspected cases, probable cases, and confirmed cases. And it will interest you to note that the median age, we have more cases in this age group between 20 and let's say 44. So our median age in Kwara is 36 years. Although the cases are a little milder in the young, so we have more severe cases in the elderly people. Okay, so let me just skip some of this in order to buy time, because where we're really going. So this is to for us to appreciate the fact that if you look at my cursor, at week 29, we had our first peak, and it started coming down. That's for confirmed cases. And if you look now, you see that the cases are rising again. It has risen beyond that of week 29, but the data I have here is as at 10th of January. So if we look at this cumulative trend, we will appreciate the fact that cases are increasing now, and we don't need anybody to tell us that the second wave is here, and it seems to spread faster than what we had the first time. So we are gradually getting to where we are going. This is healthcare worker infection. Okay, pharmacists are on the low side, 9, but that's quite huge. If you put a denominator to that, it's huge. And generally, 11% of all cases that we have had as at 10th of January are healthcare worker. So that means we have to put a lot of measures in place to reduce the spread among healthcare worker. We have done it in the past, and we have a proof that trainings like this on infection prevention and control for healthcare workers go a long way to reducing infection among healthcare workers. When we started, initially, we did not have any healthcare worker infection, but gradually in April, it started going up. And by June, we had 44 healthcare workers infected, including pharmacists. And at this point, we started.
We are still waiting to connect back to our guest speaker. While we wait to be connected back to our guest speaker, we'd like to recognize Professor Femi Oyewo. She's here with us. Thank you, Ma, for joining. The PSN Kwara State is also here, Pharmacist. Juwon Otelaja, thank you for coming. Dr. Abdul Rahman Malik in the diaspora, US, thank you for joining us. And Engineer Alege, thank you so much for being here with us. Our guest speaker is back, so let's continue the meeting. Sir, you can continue.
Yeah,
Unmute
so
yourself for your phone.
so sorry, my network here is giving me issues.
No problem, sir.
So sorry about that. I hope we can still see the screen. So
Yes, sir.
healthcare worker infections is going up gradually again. So there's a need for us all as healthcare workers to learn a little more on how we can protect ourselves and see how we can all put hands together to reduce healthcare worker infection. So distribution of deaths, like I said the other time, we've had over 40 deaths, and number of people being sampled. This again is showing a trend of cases by epidemiological week. So if we look, we can see that the cases are rising up again. So let me skip some of these to buy time. So what have we learned from all these outbreaks since it started? We have learned that the infection is highly contagious, and the main driver of the epidemic are people who have symptoms. And common symptoms, like we know, fever, cough, difficulty in breathing, loss of taste and smell. But this second wave, we have recorded a lot of funny symptoms. In fact, we have seen somebody whose only symptom was pain in the pelvic region. And by the time we started treatment, to disappeared. So the symptom strategies is to and we have also been mites are quite common. That is evidence that we have recorded, and then healthcare workers are actually at a very high risk of being infected, especially if we are not protecting ourselves adequately and properly. It's not just the availability of PPEs that is important, but the proper use of PPE. A lot of healthcare workers will use face mask and still put it on their chin. Well, in surgery, that is allowed, but in infectious disease control, it is quite.
Yes, our guest speaker is having serious network issues. While we wait for him, we'd like to recognize Dr. Kola Mustafa in the diaspora. Thank you, ma, for joining us again. Pharmacist Kuranga, Hajia Kuranga, you are welcome, ma. He is back, and so we can continue.
Please, I'm very sorry that taking us back and forth with this my network. Okay, so I hope we can see the screen now.
Yes, sir.
Okay, so I was talking about what we have learned. So we have also learned, we have seen evidence of transmission through droplets, and fomites frequently touch surfaces, and that explains the reasons why one of our major strategies is the contamination of frequently touched surfaces, which I'm still going to talk a little about later. So, and healthcare workers are at a very high risk of contracting the infection. So healthcare workers need to be adequately protected with the appropriate PPE. You need to do a risk assessment each time you have to attend to a patient or anybody. You know what level of PPE you should put on, what level of protection you need, and the PPE should be used and removed safely. And for those who put face masks on their chin, it is actually dangerous for infectious diseases. For the surgeons, they can use surgical face masks like that in the theater, but for infectious diseases, it may not be too good. We have also learned that a lot of people are asymptomatic, but many of them will progress to have symptoms later, and even some of them will have the severe disease, and some of them may even be critical. So I also learned that treatment at the treatment center has prevented a lot of deaths. I showed us a slide about the distribution of deaths. So you see the case fatality rate that is specific for the treatment center. If you compare for other places where people have died, you would discover that treatment center has actually prevented a significant number of deaths. So let me not talk about all this. So what are the strategies to to reduce the spread, especially among healthcare workers? It is a major strategy to focus on healthcare workers, because if healthcare workers are adequately protected and they understand the different measures and the transmission of the disease, they will also help in spreading the news to their patients, and every healthcare worker should be involved in risk communication as much as possible. So infection prevention and control to limit exposure is a key strategy in containing the disease. And well, we have talked about all these, a novel disease. Not so much is known about the disease, but now we can say that we know some few things about the disease. We know that the incubation period is 14 days, 2 to 14 days. Fatality rate is 2.3 to 7%. This is increasing in some places now. And for us in Kwara, is 2.26%. And there is no specific treatment. Treatment is just supportive. So the standard measures that we will put in place to reduce spread are very important, which include distancing. So distancing, covering your nose when you sneeze or cough, hand washing, use of face masks and other PPE and the likes. I will talk a little more about all these. What are the things that facilitate the spread? The environmental condition, as overcrowding, humidity, poor hygiene, temperature, air pollutants, okay, and especially in a hospital environment where there are a lot of aerosol generating procedures that contaminate the air, puts healthcare workers at a significant risk level. And poor medical care and infection prevention and control measures is also an important factor in the spread. Of course, the host factors, the immune system or comorbidities or other conditions, and the pathogen characteristics itself, it has this capability to spread very fast and to also multiply fast. So how do we get infected? Uh, Let me not bore so much about this. Let's just summarize it. Usually it's through fomites, frequently touched surfaces, when we contaminate our hands and we use the same hand, or there can be direct transmission. That's why we need to use our face mask, and that's also another reason why we should observe distancing as much as possible. Okay, so inhalation of droplet expelled from infected person directly, just as it is showing in the picture. Contact with patient respiratory secretions as healthcare workers. It may not be direct contact with the respiratory secretion. For example, a patient who has COVID-19 and sneezes into his hands, and he uses that hand to touch your phone, and you also touch the phone, you use the same hand to clean your nose. You can get infected through all this, and of course, through contact. So that's why the strategy, when we understand the transmission, we understand the strategy for prevention. That's why one of the major strategies is frequent hand washing or the use of alcohol-based hand sanitizer. So that even by chance you contaminate your hand, you wash it and you'll be fine. What are the symptoms? We have talked about this. Okay, so let's quickly go through the preventive measures and we'll be out of here. I put here as number one that we should get tested. In Kwara State, there's room for voluntary sampling. Whether you have the symptom or not, you can know your status. You can just walk down to any of the sample collection sites and get tested, and encourage people to also get tested. By this, we can also prevent the spread because we'll be able to separate those who are carrying the virus from those who are not carrying the virus. Anybody who knows that is carrying the virus will also deliberately take some actions not to infect others by isolating. And the second thing here is the use of PPEs. This is very, very important. So let me talk a little on the use of PPE by healthcare workers. I said the other time that we need to do risk assessment at every point in time. Even when you get to the market, you do a risk assessment. Look at your environment. You know, the risk assessment is just looking at the environment, how tidy is the environment, how dusty is the environment, is anybody coughing in the environment, how many people are not using their face mask. Those are the things that you consider to know what level of risk you are exposed to. So when you're attending to somebody who's not using face mask, you're exposed to a particular level of risk. Even if the person is not yet confirmed, it may be an asymptomatic carrier. So this will inform what level of PPE we should use. So of course, generally, when you have to interact with people, you use your face mask properly, your surgical face mask or cloth face mask, and you also avoid face-to-face interaction. It has also been proven that if you have face-to-face interaction with somebody who's carrying the virus for more than 15 minutes, it puts you at a significant risk level. So avoid face-to-face interaction. In fact, I am very bold to say here that it's only in Kwara State that none of our first-line responders have been infected with COVID-19 in the whole of Nigeria. And one of the strategies we use is very simple and funny. We don't take sample in front of the patient. So we avoid face-to-face interaction as much as possible. Even when we attend to the patient, we will always stand by the side of the patient. And there is there is a proverb, a Yoruba proverb that I have changed. I pray and assume that the Yoruba leaders will accept that. They say Oju lorowa. So for COVID-19, we usually say Iti lorowa. So as much as possible, avoid face-to-face interaction with your clients, and this will reduce your risk of having the disease. So who are the people that should put on PPE? Generally, now it's everybody. As far as when we talk about face mask, when you know you are going to crowded places or you are going to places where there are a lot of people. Okay, but particularly for healthcare worker, it goes beyond the use of face mask. Okay, first, the face mask must be properly used. You see, a lot of people call it nose mask. It is quite wrong. Okay, nose mask is used by engineers that mix chemicals. They don't want to perceive the odor, so they cover the nose. But for this, the ideal way to use face mask is for you to cover your nose and your mouth. So if at any point in time it's not covering your mouth, it's worse than not using it. And if it's not covering your nose, it's worse. And we also notice that when people want to talk, even in gathering, even when you are sharing mic, you are in a crowded place, they tend to remove the face mask to talk. This is also very wrong. And for those who also put face masks on their chin, it is also very wrong. Even touching the face mask is wrong. So I'm going to talk briefly on how to don and doff. Don and doff is just putting on the PPE, and doff is safe remover, because most healthcare workers get their infection at the point of removal of PPEs. Okay, not because of unavailability of PPE. Most healthcare workers are infected from the PPE at the point of removal because they are not safely removing it. Okay. So this is just to guide us for the risk assessment. At what point are we supposed to perform hand hygiene at all time? And when you look at gown, when do you need to wear gown? We just cite example here. If you are a triage staff, you don't need to put on gown. But if you need to collect specimen for COVID-19, you need to put on gown, and just to guide us about the risk assessment. Okay, so at every point in time, generally, if you need to put on any PPE, be it your face mask, your gloves, or whatever, for the control of infectious diseases, it's quite different from the way we do it at the theater or when we are performing other medical procedures. For infectious diseases, you must ensure that at every point in time, you need to put on your PPE, you must perform hand hygiene. Even if it is just your face mask that you want to put on, before you touch your face mask that you're putting on is assumed to be sterile. Okay, so before you touch it, you must also make sure your hand is sterile. So, and when you are done using it, you doff it and you dispose it immediately. If it is reusable, you only doff it at the point where you are going to wash it. So as you are doffing it, if it is a washing machine that is going to wash it, you doff it directly into the washing machine. If it is a bowl you want to use to wash it, you doff it directly into the bowl. So it is not proper to be using face mask and be keeping it in your pocket or keep it in your bag. Okay, always make sure you have your size, and in situations where your size is not available, go for oversize, but don't do undersize for any PPE. And have a plan of how you want to don and doff, like we have said, and always perform hand hygiene, like we have said. So this is a face mask. I'm going to try and rush a little more now. I guess my time is already up. So before you wear your face mask, like we said, you perform hand hygiene. So when you perform hand hygiene and your face mask is sterile, you can touch any part of the face mask and wear it, make yourself comfortable. But immediately you put it on, don't touch the front of the face mask. And if you are using surgical face mask, the colored part should be outside for infectious diseases, while the white is touching your face. But see, for surgery, it may be the other way around, but for infectious diseases, that's the best way to put it to reduce your level of risk. You will also notice that face masks usually have some surgical face masks, especially like pockets where particles can hide. So that place should be facing down so that the force of gravity will not allow particles to stay there. So you perform hand hygiene. So if you are using the respirator or N95, once you perform hand hygiene, you can touch any part of it and put it on because it is also sterile. Your hand also is sterile. But immediately you are wearing it and you are using it to interact, don't touch the surface. I see a lot of people touching the surface of the face mask, trying to adjust it. That's why we said it's good for you to get the appropriate size, and it's also good for you to wear it properly so that once it is worn, you don't have to touch the surface, even if you need to adjust maybe by the side. Okay, so you put on your face mask, and if you need to perform an aerosol generating procedure on a patient, or you need to take a respiratory sample, it's advisable you use N95. And when you're using N95, it's also advisable you do the seal check. Check if the N95 is appropriate for you and if it is sealed. N95 is expected to be sealed. So when you try and breathe out, you feel the air back on your face. And when you try and forcefully breathe in, you feel the N95 trying to collapse. So that's just to confirm that it is sealed and there is no space. Okay, so the goggles too, the same thing. You perform hand hygiene before you wear and once you wear. So let's come to gloves. We all know how to wear gloves, so I'm not going to talk about donning of gloves, but doffing of gloves is very important. At the point when you are doffing glove, yes, this is it. So the pictures here describe how you doff gloves. So once you are wearing your gloves, it's assumed it is contaminated. It is rubber, so the rubber is contaminated. So if you want to remove it, you can use the first hand to touch the other hand at the part where the glove is covering. So we call it rubber to rubber. So don't allow rubber to touch your skin or your clothes at any point in time. So it should only be rubber to rubber. If you see the first picture here, you appreciate the way it is removed. So you lift it up a little below your palm, you lift up the rubber and you remove. And once you have removed, that hand is assumed to be sterile, your bare hand. So to remove the second glove, you put the hand under. So your hand is now skin to skin. So your hand is touching the other skin, and then you just lift it up like that. And immediately you remove it, you perform hand hygiene. You discard and perform hand hygiene. So hand hygiene is very, very important. I'm going to talk a little bit on that. I've talked about how to remove. So if you have to use the respirator, the N95, is better you remove the lower strap before the upper strap, because when you remove the upper strap first, the N95 will tend to move towards your eyes and you can get yourself infected through that. And anytime you are removing your face mask or N95 or face shield or goggles or any of the things you wear to protect your airway, you try as much as possible to close your eyes before you doff. Sorry, I really need to rush. That's why I'm rushing this much. So I'm going to talk a little about hand hygiene now. So hand hygiene is washing your hand with soap under running water, or you use alcohol-based hand sanitizer. So for this, because COVID-19, the organism that causes it, that SARS-CoV-2, is quite fragile compared to other viruses. So 65% alcohol-based hand sanitizer is enough to kill the virus if properly applied. And the essence of hand washing is not just to wash away the virus, it's also to kill the virus, because we have discovered that the covering of the virus is a lipid. And the soap will also help if enough mechanical action is put in place and the soap foams very well to dissolve the outer cover of the virus, thereby killing the virus. So let's talk a little bit about that. So hand hygiene should be performed as much as possible before you see your patients. When you touch surfaces, when you touch your patient, these are the different moments where you need to perform hand hygiene. On arrival at your workplace, on arrival at home, if you mistakenly shake somebody, perform hand hygiene, whether you wash your hands or you use alcohol-based hand sanitizer. After removing your gloves, also perform hand hygiene. Okay, so so let's see if we can go through the steps of hand hygiene. Okay, you know, we said when you have to wash your hand, you should wash with soap under running water. If you are using alcohol-based hand sanitizer, you also apply it to make sure you cover every part of your hand. Is because the reason why we are focusing on the hand, because I know someone has asked me that why not your elbow, why not your forearm, why not your chest, why not chest hygiene? The reason why we are focusing on the hand is the hand that we use all the time. We use hand to pick phone, we use hand to eat, we use hand to do everything. And if you wash your hand the way we usually wash it, these are the areas you are likely going to miss. The fingertips, the thumb, palms. Let me show us the picture of those areas. So these are the areas you likely miss if you wash it the way we have been washing our hands routinely. Okay, so that's the reason why we have steps to hand washing, or even when you are using your alcohol-based hand sanitizer. So we can see these steps here. I hope everybody can see this clearly, except for those using their phones. The picture may be too small, but on request, I can send this for us to appreciate it, because these steps are supposed to be illustrated, performed practically. So you use running water, you apply your soap, you switch on your water. While the water is running, you rub your hand, and of course, you do for the dorsum of the hand, the back of the hand, the interstitial spaces, and your knuckles. You form knuckles, you ensure in between your knuckles. You clean your thumb. If you look at frequently missed area here, you see that the thumb is one of it. So you take a particular effort to make sure you don't miss your thumb. And then when you are rinsing the soap, and of course the soap should foam. If the soap is not foaming, you may not achieve what you want to achieve. So when you are rinsing it, you also quickly go through those steps. And when you are using your alcohol-based hand sanitizer, is practically the same steps that you follow, just to make sure you take care of every part of your hand. Okay, so we must remember that hand hygiene must be performed at the point of care, and let's not forget the different moments of hand hygiene. Effective hand hygiene results. If it's going to be effective, it depends on everyone's adherence, appropriate techniques, and you rub your hand for at least 30 seconds. The mechanical action also assists in destroying the virus. So what are the major obstacles to hand hygiene? People will say I was busy. Some people will say, well, I wore gloves. Hello?
We can hear you, sir.
Okay. So some people tend to think, since I wore glove, I don't need to wash my hands. Well, maybe for other purposes, you may not wash your hand, but for infectious disease control, even if you wear 10 layers of glove, it's still important to wash your hand. In fact, if you are wearing 10 layers of glove, the way we do it is, as you are removing it layer by layer, you wash your hand, you perform hand hygiene. So if you remove the first layer, you perform hand hygiene. You remove the next layer, you perform hand hygiene till you remove the last layer. Okay, some people will say, I forgot. So put every measures in place to remind you to wash your hand. And some people will complain that it hello.
We can hear you, sir.
Oh, okay. Sorry, I was hearing some noise. Okay, so these are the main obstacles, reasons why people don't want to perform hand hygiene. But the truth of the matter is, hand hygiene is the most efficient, effective means of preventing infections, especially among healthcare workers. Somebody will ask that as a first line responder, maybe we have some other things we had that is protecting us, that we have not come down with the disease. These are the simple methods we use, and we have proven that it is very effective. Okay. Our first case in Kwara, we applied these measures to his family as much as possible, and to the glory of God, none of his family members was tested positive. Okay, so hand hygiene is the single most important thing you can do to prevent infections generally. Hand washing, hand sanitizer, use of hand sanitizer. Okay, and hand washing should be with soap under running water. You should always wash your hand, uh, even when they are visibly soiled. Okay, so but before I end this, I did not put here the contamination, which is also very important. So usually we use alcohol for decontamination, just like the one we use for sanitizer, at least 65%. But because it is very expensive, um, another thing that we can use is sodium hypochlorite, which is contained in the regular hypo or jig. So if it is properly diluted, you can use it to decontaminate. And there are different methods of decontamination. You can spray, you can wipe, you can immerse, depending on what you want to decontaminate. But it's important for every healthcare worker to frequently decontaminate, frequently touch surfaces in the offices, your toilet handles, your door handles, your table surface, your chair handles, and the likes. Always decontaminate as much as possible. And don't keep the contaminant in a transparent container. So it's better kept in a colored container. And when you dilute, try and use within 24 hours. If you don't use within 24 hours, don't use the next day. And when your surfaces, the table is visibly soiled with mucus or fecal matters or urine or any organic matter, you may need to increase the concentration of the solution used to decontaminate such. So, or you clean it before you decontaminate, because there's also been proven that organic matters deactivate sodium hypochlorite. And secondly, detergents also deactivate sodium hypochlorite. So when you want to wash and decontaminate, it's better you do it separately. So you wash first and then decontaminate. You get the best, even for your white clothes that we use hypo for. It's better you wash it and rinse it before you now soak it in hypo. You get a better result. But when you mix hypo and detergents, like most of our cleaners do, detergent deactivates the hypo. So the surface you are decontaminating may actually not be safe, may not be decontaminated as expected. So if you are going to wipe with detergent, it's better you wipe with detergent first, and then you now use your hypo to wipe. So I think from here, we can take questions. I'm sorry that I took so much time.
Thank you so much, sir. We appreciate you for the presentation. It was quite educative and insightful. And from what you have said, is not to adequately protect ourselves, but properly protect ourselves. He actually stressed that a lot, that we should properly protect ourselves. Thank you so much, sir. We appreciate the presentation despite the challenges of network. We'll call on, the questions will come after the presentation, sir. So you kindly wait till the end of the presentation. You can still type in your comments and questions in the chat box and we'll attend to it. We'll call on our second speaker, amiable pharmacist, Oladayo D, for his testimony. He is a fellow of the Pharmaceutical Society of Nigeria. He is the Deputy Director of Pharmaceutical Services, University of Ilorin Teaching Hospital, and is the head of unit of Operation Park Pharmacy Department, UITH. He's going to share his testimony and experience with us. Our fellow pharmacist, Alige, over to you, sir. I can see you.
Thank you very much. I say good morning to each and every one of us. Are you hearing me?
Yes, we can hear you loud and clear.
Oh, it is my pleasure to be here to share my testimony about my experience with infection of the coronavirus. Once again, I'm pharmacist Alige Hamid Olanriwaju, a fellow of Pharmaceutical Society of Nigeria. I can see my chairman there. Well, a friend asked me, why am I coming on board? And I said, why not? Why will I not come on board to share my testimony, to thank God for sparing my life? For about 3 weeks, I was on oxygen. And I really, really thank God for making me see year 2021. All this happened late November up till the end of December. So I thank God for everything. Then he said, you must be an hero or conqueror. I said, who am I? I didn't do any fight. God fought for me. And I thank him very sincerely for being alive today. How did I contact COVID-19? Honestly, I wouldn't know whether it was through a treaty or where I went. I don't know. All I knew was that I was feeling feverish, I was weak, there was mild cough, and I contacted my private doctor in a private facility. He asked me to come. I drove myself down there. So naturally, he thought it was malaria. So he gave me some anti-malaria. First day, second day, third day, when I was to take the last dose. I said, my doctor, I'm not feeling any better. And this is the last dose of the anti-malaria. Then he tested my chest and recommended, he said he's not feeling comfortable, so recommended for X-ray, among other laboratory investigations. And at the end of the day, he said, my friend, you have to go for COVID-19 test. Yes, just like the last speaker have said, it was free. It's still free at the State Ministry of Health, Kwara State. So I went there and they took the sample. And of course, I was shocked, but not too surprised because we all knew about it. We all knew we were exposed. So, and that was how it happened. I must say that COVID-19 is real. It is real. I've experienced it, and I thank God once again for going through it. If I was asked to go through this test again, of course, I will. I will go because I want to remain constantly safe. Like I said, from that private facility, I was referred to the teaching hospital. And from there, the Kwara State Subi Isolation Center was contacted. I was highly impressed when they came, all kitted, and took me away from the teaching hospital. Got to the center where I was given a room, a separate room. And at that time, my oxygen level was very, very low. But thanks to the doctors, the pharmacists, and other support staff at the isolation center, they responded promptly and adequately to ensure that I was on oxygen. This I did for about 3 weeks, constant supply. I hear here and there that a lack of oxygen supply was major problem here and there. But then at Sobi, it was constantly available. Every 24 hours, I used to have 3 cylinders in my room, changing from one to another. So I must appreciate the state government for providing this free of charge. Not only that, 3 squares meal was also provided throughout free of charge. And this, many people did not know it's happening there. I saw it, I experienced it. And I must say that I am indeed very, very grateful. I'm also grateful to the management and other staff of the University of Ilorin Teaching Hospital, my colleagues here and there who after discharge accepted me the way I am. I'm okay, I'm fit. I have been given certificate of a clean bill of health. Of course, there were friends and relations, family members who were waiting for me to, to arrive. I must say COVID-19 is not a death sentence. One can get over it just like I did. Thank God. I must also thank my well-wishers far and near from various parts of the country who wish me well. I must also say that the reaction of the people around me was very, very friendly, very encouraging. Like I said, I reported back to work. I'm at work now. And my colleagues especially just took me the way I am, and I'm fully fit. Thank you all very, very sincerely. I will say that the reality of COVID-19 is still there with us. It is very, very real. Unlike many people will say, oh, there's nothing like that. I'm sorry. I'm sorry. COVID-19 is no respecter of anybody, any age, male or female. It can affect doctors, it can affect the pharmacists, engineers, drivers, teachers, students, soldiers, and so on. No respecter of anybody. So it is very, very, very real. And we must always prevent it as much as possible. If I must say the messages or advice I have for you out there, just like first speaker have said, for those of us who are health workers, personal protective equipment is very, very key. And as much as possible, we must wear it always. Wearing a face mask properly and always is equally very important. We must wash our hands as often as possible, at least 40 seconds per wash with soap and running water. Of course, if this is not available, we can use our alcohol-based and sanitizers. We must avoid touching of eyes, nose, and mouth, or generally our face, because possibility of infection still very, very high. I know a lot of people indulge in steam inhalation. Yes, this is good, at least maybe once in a day, especially when we have had contact with people from outside. Daily exercise for about 15 to 30 minutes is also recommended. And we must continue to pray to avoid this pandemic. So, ladies and gentlemen, the reality is that COVID-19 is there, it is real. And I implore each and every one of us to get tested, because a lot of people out there are asymptomatic. Please get tested and to know your status. Once again, I thank you all for your support. I thank you very sincerely. I thank God for saving my life. I'm back on my feet. Thank you.
Praise God.
Hallelujah.
Thank you so much, sir, for that testimony you shared with us. I guess we all gained one or two things, and we thank our guest speakers for the insightful and educative presentation. We want to appreciate Pharmacist Margaret Obono, the DPS National Orthopedic Hospital, Yaba, Pharmacist Makide Federal Medical Center, Owo, and then Pharmacist Barakat Olariwaju, Kwara State DPS, and Pharmacist Joshua Nalazia. We appreciate you all for staying even to the end of this presentation. Thank you so much for joining us. We now have it's question and answer time, and it's going to be just 20 minutes. So you can kindly raise your hand. 15 minutes. Kindly raise your hand or attend to the chat box now. question and answer from the chat box. We have good presentation in spite of the network from Pharmacist Mbak Femi Oyewo. Pharmacist Otelaja is thanking the presenter for a wonderful presentation. Pharmacist Rahim wants to ask his question. Over to you, sir. Dr. Abdurrahim Malik, kindly unmute yourself and go ahead with your question.
Okay, thank you very much, Dr. Awoyale. I hope I'm not going to be asking too many questions. I have just three. Questions. Can I go ahead?
Yes, sir.
Okay, Dr. Awoyale, thanks for your information. It was very educative. My first question is, there is a dose of mectizan, ivermectin being used currently. I mean, medication, sorry. What is the Kwara State's recommended dose for this drug? There are doses all over the place, so I would like you to chip in on that. I have dispensed personally 21 milligram BID for 5 days, 3 days, 4 days, all sorts of doses all over the place. Then my second question is, what is the state government or your committee? I believe you are in the COVID-19 committee. What is the state government doing about stigmatization of this COVID-19? Because if you notice, a lot of people are not coming up to test. From what my senior colleague said while he was doing his COVID-19 presentation, if you notice, he mentioned people are not aware of even the way he was treated in the center. So people don't know what is going on. What is the state doing to make people come out and test? Not just to open the testing centers, but to encourage people and say, look, this, like here, if you have a COVID, like when I got the COVID, there was no stigmatization. Everybody knew. I came out and said I have COVID. They sent me home for 3 weeks. People were calling me. I was telling people. But in Nigeria, even to test, people will run away if you want to give them free test. There was a time I was doing it at Rotamedics, and some people don't want to test. They'll say, no, don't test my temperature. Don't test my temperature, please. They'll run away. So what is the state government doing about that? My final question is, you mentioned the issue of gloves, putting on gloves. While that protects the healthcare worker, what about the patients? Let's assume, for instance, I'm a pharmacist, I attend to my customer, I don't know the person's status, and I have on gloves. If I attend to someone with COVID-19, my gloves are contaminated, then I attend to the next person. Am I not spreading after that unknown person that I attended to? Those are my questions. Thank you.
Dr. Awoyale, are you on? Kindly respond to the question. Dr. Awoyale, are you still there?
Yeah, I'm here.
All right, sir.
Hello? Yeah.
Yes, sir, we can hear you. Go ahead, sir.
Okay, so I did not hear the first two questions well. I think the network was breaking, but the last one I heard very well. So let me quickly attend to that while it will recap on the other questions. So the use of gloves. You know, I said it's important for you to, can you hear me?
Yes.
Yes, sir, we can hear you.
Okay, so it's very important to do risk assessment at every point in time. If you are dispensing drug, sincerely, there is no need for you to use gloves. Okay, so you need to do a very short risk assessment to know what level of risk you are exposed to, and that is what will now inform what level of PPE you will put on. So if it is just to dispense drugs, you can still maintain your distance. You can,
a couple of things. But if you have to attend to somebody who is coughing, who is not using face mask, who is not using all these, for example, you know that it's very important to use your own face mask, okay? But even at that point, you don't still need gloves. But if the person is now discharging, there are discharges that you need to touch, or you need to touch the patient to examine. You know, at that point you need to use glove. And at every point that you are using glove is disposable. What that means is one glove, one patient. So if you are using glove, you must dispose it immediately after use for the first person. You cannot use the same glove for the other person. And even if you are not using glove, you must perform hand hygiene before you attend to the next person. So once you finish using your glove, you've attended to that person, before you attend to the next person, you perform hand hygiene before you attend to the next person. So if it is just to dispense drugs, you don't need to use gloves. So please, can you quickly help me with the second and the first question?
Okay, his first question was mectizine, ivermectin, the dose, the acceptable dose. And then he talked about the issue of stigmatization in Kwara State.
Oh, okay. So starting with stigmatization, sincerely for COVID-19, there is no stigma about it. It has not been proven that whoever has recovered from COVID-19 will not be able to have children again. It has not been proven that if you recover from COVID-19, you are not going to live long. So I don't know where the stigma is coming from. For HIV, it's understandable that it's because it's sexually transmitted. There's some level of stigma. People will see you as being wayward or something if you have HIV. But for this, we are at the stage of community transmission. You know, when we started the response, we were linking all our cases to the source of infection. So epidemiologically, we can see that, oh, this person had the infection because he has had contact with also person who is a confirmed case. Or this person has the infection because he just came back from Brazil, okay? But now we are at this stage of community transmission. It is difficult to link our cases. So you can assume that the next person you are sitting to may be carrying the virus. So in that case, if one is infected, I don't see any stigma about it. It's not because you are uneducated that you are infected. It's not because you are wayward that you are infected. So sincerely, there is no stigma about COVID-19. But unfortunately, we have that challenge, okay? People want to keep their test as much as possible because of our lack of information. People are not well informed, so they tend to feel, oh, if this person had COVID-19, let's run away from him. But sincerely, for me, that's even a plus. If you are running away from me, you are protecting me, because it may even be you that will come and infect me or my family or somebody. So if you think you want to run away from me, you want to stigmatize and run away from me, you're already helping me to observe physical distancing. So there is no stigma about it. It's just lack of information. That's why we all have a lot of work to do on risk communication to educate people about this virus and its transmission. And the fact that somebody has COVID-19 today does not mean that the person has gotten his death sentence. It does not mean that he cannot be reinfected. Okay? So, and the fact that you are negative, you did test you are negative, does not mean that if you expose yourself in the next 1 hour, it doesn't mean that you can't get it. So in fact, in Lagos, they have evidence of a lot of reinfection. I have a friend, a doctor in Lagos, who is part of the team, who was infected. He got well, he was tested negative, and after some months, he was infected again. So the fact that somebody is negative does not make you better than the person who is positive today. So the truth of the matter is, sincerely, the message that we should pass to people is that there is no stigma about it. And very soon you will start seeing some of our videos that we are doing in Kwara to make sure that people get the right information. Don't stigmatize. You see that when the deputy governor himself was infected, he announced openly on Twitter, on social media, he announced. And that's to say there's no stigma about it. To encourage others to also get tested. A lot of people that are even stigmatizing, they may also be carrier too. They may be asymptomatic carrier. And you know, in Nigeria, we are very rugged people. People don't see cough as a symptom, as a problem. They will tell you that they are just trying to clear their throat, and you are seeing them coughing. Okay, so they don't see it as a problem. So some of them, they may even be carrying the virus too. And for the dose of ivermectin, well, there are a lot of studies that have been done on ivermectin to, of course, to see how effective it can be against COVID-19. But the dosage is not something that COVID-19 is not a disease that we advise on the counter treatment. It's not a disease that we advise. Even health facility is only health facilities that have the required, because the major treatment for COVID-19 is supportive. So if you are attempting to treat in your facility where you don't have an oxygen plant or something, and something goes wrong, and you are not monitoring the oxygen saturation of the patient and all those things, those are far more important than the drugs you ingest. Okay, so even if ivermectin is available and you are using it for treatment, if you are not giving the necessary supportive care, which in this case, most of the time is oxygen, they are not giving that, lack of oxygen will kill the patient before the ivermectin will kill the virus. Okay, so it is not something we advise. Even hospitals, we don't advise them to treat COVID-19. At the point where the patient is confirmed to be having COVID-19 and is symptomatic, the best is to be treated at the treatment center. But at the point where you are still suspecting, as you are suspecting, you are treating other problems that the patient have. If it's a non-diabetic, you are taking care of it. Because if you abandon patient because you are suspecting him to be having COVID-19, the other issues that patient have may kill that person. We have recorded a case of somebody who died of asthma, a non-asthmatic patient, went to his private hospital, the private hospital he has been using for years. And those ones were like, oh, this man is looking like COVID-19, they all ran away. Okay, before they were able to take the patient to another hospital, the patient died. So we have recorded that too. So sincerely, it's not advisable to treat COVID-19 in other places except the isolation or the treatment center.
Thank you so much, sir. We appreciate you. We'll call on pharmacist, caller Adiogun, and that will be the last question for today. Pharmacist, caller Adiogun, my guys, over to you, sir. Unmute you.
Okay, good afternoon, everyone. Good afternoon, everyone.
You can hear you,
Yes, I want to really appreciate Dr. Awoyale for the presentation. Talking about community transmission, sir, there's this general belief. I've had interaction with some people, and they believe that COVID-19 is the disease of the affluent and the rich. That a common man who is an artisan cannot get COVID-19. Please, can you speak very clearly on this matter? Thank you very much.
That was the voice of Pharmacist Busayo Elegwede, DDPS ITH. Sir, you can respond to the question.
Okay, thank you very much for that question. If you ask me, COVID-19 has affected more poor than the rich. Okay, so, but it's only the rich and the popular ones that will make the news. If a poor man in my village, even if he contracts COVID-19, even if he dies, is not likely going to make the news. NTA news will not carry it, talk less of AIT. But if any politician or any leader has it, it's likely that it will be everywhere in the news. So if you ask me, it has affected a lot of poor more than the rich. Based on if in Kwara now we have recorded more than 1,800 cases. As active as I am in the response, if you ask me to mention how many rich in this over 1,800 cases, as I'm sitting now, I doubt if I'll be able to mention up to 10 or 20.
So it's important.
But if you ask me to mention how many poor that I can mention as I'm here now, I can mention more than 50. So it has really affected a lot of poor people, but they don't make news like the rich do. So sincerely, from our data, COVID-19 is not a respecter of person. Does not respect your color. Hello?
We can hear you, sir.
Okay. So COVID-19 doesn't respect your color, doesn't respect your age. If you look at our age distribution, we have had cause to screen a 4-month-old. We have recorded a 7-month-old that was infected, and we have recorded people above 82. So once you are exposed, it depends on how protected you are. That's what will determine whether you'll be infected or not. So in fact, the worst of our cases are the poor. The worst cases that we have recorded, the ones that really needed a lot of oxygen, the ones that could not make it, that died, many of them are poor. If you look at the data again, we have recorded over 40 deaths. How many of those 40 deaths are prominent people in Kwara? How many can we mention? If we start looking at it, maybe just 3 or 5. Okay, so it's not a disease of the poor. It doesn't respect age. It doesn't respect your wealth. Just get protected. Take responsibility and always protect yourself and your environment.
Thank you so much. Thank you so much, sir. During the course of your presentation, sir, Pharmacist Dorothy wants to know, you mentioned somebody with pelvic pain as part of the symptoms of COVID-19, but because of the network issue, we didn't get that. So she wants you to clear the air on that, sir. You mentioned somebody,
okay.
lady with pelvic.
What I was saying was, I was just trying to emphasize the fact that the symptoms are not specific. Okay, topping the list is fever, cough, difficulty in breathing, loss of taste and smell. But in this part of the world, it is difficult to judge with fever because an average Nigerian uses paracetamol every day with or without illness. So most of them may not have fever. 2, the fact that we are observing physical distancing, you will discover that most healthcare workers that assist in screening for fever, it is when they are screening for fever that they will remember physical distancing. And you will agree with me that if you use the infrared thermometer and you still observe physical distancing, you may not be checking the temperature of the patient. You may be checking your atmospheric temperature. That's why at times when you get to the airport or ShopRite or shopping malls, they check your temperature. If you ask them, they will tell you it is 25. You agree with me that a temperature of 25 is not compatible with life. So these are not enough to say somebody is not a suspected case of COVID-19. Okay, so we have seen a lot of unspecific symptoms. So there was a particular lady whose only symptom was pelvic pain. And because this woman just came back from America, that was the reason why we tested her, and she tested positive. And by the time we treated her for COVID, the pelvic pain also disappeared. In fact, the woman said the reason why she felt is something strange is because the last time she felt that kind of pain was when She was a very young lady. The woman is quite elderly now. He said it was before she got married. So immediately she felt that pain, she knew that something very strange is happening. So coupled with the history of travel to America, so we decided to test her, and she tested positive. And when we treated her for COVID, the pain too disappeared. So it's just to say that it's not enough. Now we are recording a lot of people with diarrhea. When we started, we limited it to just respiratory symptoms. But now a lot of people with diarrhea, a lot of people with pain, bone pain, joint pain. One of our very senior colleagues, his own symptom was, he said it was like something came and took away all his energy. So he was too weak to even eat. He was very weak. He wanted to eat, he's hungry, he has the appetite, but he was very weak to carry his hand to eat. Okay, so the wife had to be feeding him. So these symptoms are not specific at all. So the absence of any of the symptoms is not enough to say that this person will not have COVID. And that's why there is room for voluntary testing. Whether you have the symptoms or not, whether you have other symptoms or anything, you can get tested free of charge in Kwara State. Thank you.
Thank you so much, sir. We appreciate you for the presentation. It's been quite insightful, educative, and interesting. And while we wait for the vaccine direct administration, the message today is proper protection. We should properly protect ourselves. All our guest speakers emphasize that. We'll call on Pharmacist Ayetoro for the vote of thanks.
Good afternoon to everyone again. We really want to appreciate everyone that has participated in this Zoom meeting. We want to thank Dr. Oladayo Awoyale of Ministry of Health, Kwara State. We called you and you answered us. We thank you so much for your time and for giving us information that most of us didn't even have. On behalf of our acting HOD and the other pharmacists in UITH, we appreciate you, sir. Then we thank our own pharmacist, Hamid Lanre Alide, for finding it worthy to come out and give us his experience. Before he contacted the infection, we had 5 pharmacists in UITH that tested positive. And when that happened between July and August 2020, we were so devastated in UITH, and we didn't know what to do much, but we were praying for them and preventing others from contacting the infection. But the testimony we have today is that none of them died, and we thank God for that. And since then, we have been trying as much as possible to prevent anyone from contacting the infection. Part of what we do that our home management also helped us, we were able to produce alcohol-based sanitizer, which helped the hospital community. So we thank the management of UITH for this, for providing the fund for us. We pharmacists, we produce the sanitizers. So on this note, I want to thank everyone that has stayed from 11 a.m. of Nigerian time up to this present moment to listen to our story, to everything that has happened today. We acknowledge you, we thank you, and God bless you. Until we bring another one from our Drug Information Unit, UITH, we say bye-bye and God bless.
Thank you so much. We've come to the end of today's technical. Thank you for staying to the end. We are signing up now.
Okay.